Dr. Sancha, could you please explain us why the green laser is considered the gold standard in urology?
Well, the green light laser is a very safe treatment method for benign prostatic hyperplasia. It has been recognized by the American Urological Association guidelines and also the European Association of Urology guidelines as a standard option of treatment for men who suffer from BPH.
And what is the difference with the classic method of operation?
Well, classically there were two methods for operating prostates. One was an endoscopic method, which used an electrical cautery to remove pieces of prostate, but the coagulation of this method was not good, so patients bled in average half a liter during the operation, and they needed to have a catheter for many days. They stayed in the hospital for many days, and there was a rate of transfusion, impotence, incontinence that is now no longer a problem with the green light laser. For bigger prostates, classically there was the open prostatectomy, which was even more traumatic for the patients. So the green light laser allows us to treat patients with BPH with minimal discomfort, with very short hospital stay, and of course all these risks of heavy bleeding, impotence, incontinence have disappeared.
Are there any risks when making the operation, and for what patients this operation is suitable?
The operation with the green light is one of the safest operations in urology. Of course, there is no operation that has no risk, but with green light we can operate patients even when they are very old, when they take anticoagulant medication, when they are cardiac patients. We can operate these patients with great safety, and the published complication rates are extremely low. So it's the safest way of treating patients with BPH existing today. Well, we can operate any patient with green light, but it's especially useful for patients that were condemned to keep a catheter, for the rest of their life before, because they were considered not good candidates for surgery. Prostate surgery was too dangerous for them, and they were condemned to keep a catheter for the rest of their life. So green light is especially good for patients who are weak, who are anticoagulated, who are have cardiac diseases, diabetics. All these people benefit from green light surgery.
Dr. Sancha, you have operating sessions all over the world. What are your impressions from the Bulgarian patients?
Well, my impression is that the complexity of Bulgarian patients is bigger, it's more than the complexity we see in other places. Probably because in other countries patients go to the doctor more often. In many countries patients, when they become 50, they do a yearly checkup with the urologist. And in Bulgaria, I think patients don't do this. So when we see them here at the Hill Clinic, they usually have bigger prostates, they have bladder stones, they have complications of their disease because they have not looked after themselves properly. And I have to say that my experience with the staff, doctors and the staff personnel at Hill is very good. It's amazing. I feel like at home. The quality of the doctors and nurses at Hill is amazing.
And what would you advise the patients?
Well, I would advise patients to check themselves every year after 50. I would advise them to check themselves earlier when they're 45 if they have a relative with prostate cancer, because there's a higher risk of developing this disease. And now that surgery is no longer such a terrible thing with so severe post-operative problems, I would advise them to take the decision to operate as soon as they need it and follow the advice of the doctors, because my impression is that Bulgarian patients wait too much to go for surgery when they have urinary problems.
Dr. Sancha, the patients prefer green laser, obviously, but how is it in the other countries where you've been operating?
Well, patients in other countries have a lot of access to medical information, and they are aware of the potential complications of plastic surgery. So when they come to see us, for example, what they're looking for is the safety. This is a comfortable procedure for the patient, you know, the fast recovery. Many patients come because they want to work and they want to continue working. So if we operate them on a Friday, they can work on Monday. So patients are clearly demanding this more and more worldwide. I think there's only a few countries in Africa that are not doing green light, but apart from that, green light is available all over the world now.
And could you please tell us something more about your experience here in Hill Clinic and the doctors?
Well, we have been working here for almost 3 years now with green light, and I have to say that this is one of the highest volume centers in Europe, because we have got a lot of patients, and I have trained the doctors at Hill Clinic so they can perform a wonderful job. And I would say that this is a highly specialized green light laser center, and the quality, because I have traveled all over the world and I have seen other surgeons performing. These guys at Hill Clinic can do work which is sometimes much better than what you can get in very, very, let's say, famous American hospitals.